Now, in Spain, experts are saying that restrictions are too little, too late. Beverly Madrid joins us live from our EBC Madrid Bureau, or Spain Bureau. Hello, Beverly.
Hello, Alma. Nice to be here again.
Good to see you. How have you been?
Thank you.
So your experts are saying that it's too late. Why?
Yes, that's true. As the city of Madrid braced Friday for the imposition of new restrictions to curb the soaring rate of infections, Spanish experts warned the measures were too little, too late, and would be very difficult to implement. The partial lockdown, which was also applied to 9 other nearby towns, has recently come into force, with people only allowed to leave the city limits for work, school, and medical or legal reasons. Madrid's regional authorities have criticized the restrictions on citizens' movements as too stringent. But for healthcare experts, they simply don't go far enough. According to Salvador Pero of Fisavio, a healthcare research organization in the Valencia area, for all epidemiologies, these restrictions are coming very late. They should have been put in place much earlier. By the start of September, closing off the perimeter was a measure which was very easy to implement in certain towns, but very hard in large cities such as Madrid. He said, pointing out that hundreds of thousands of people travel every day, often on public transport, to work in nearby towns. Fernando Garcia, an epidemiologist at Madrid Public Health Association, also expressed surprise that they did not include a recommendation to work from home, as during the 3-month lockdown that started in March. And he thought the restrictions on seating capacity in bars and restaurants, reduced to 50% indoors and 60% at terraces, should have been greater. Others said merely reducing mobility was not enough, given the scarcity of track and trace resources, with the Madrid authorities urgently requesting military help. Madrid is currently struggling with an infection rate of 730 cases per 100,000 people, compared with just 300 per 100,000 in the rest of Spain, which in itself is the highest in the European Union. According to the government decree published on Thursday, restrictions must be imposed on all areas that have counted more than 500 cases per 100,000 inhabitants over the previous 14 days, but experts said the rate should be lower. Ildefonso Hernandez of the Spanish Public Health Society, or CESPAS, said a threshold of 500 cases per 100,000, and in the UK, the trigger rate for restrictions was 100 cases per 100,000. Even within the rest of Spain, limitations have been put in place much earlier in regions like Asturias, Galicia, and Valencia, where they kicked in with an incidence of fewer than 100 cases per 100,000 people. The virus has now killed nearly 32,000 people in Spain and has infected around 760,000. Back to you, Alma.
Right. Oh, that's sad. But have you observed the people there? How are they complying with the new restrictions in Spain? You see not too much people on the road or on the streets? Or
there are still a lot, for example, here in Brazil, there are still a lot of people, for example, in the public places like transportation. Mm-hmm. There are still a lot of people, especially in rush hour, which is from 7 to 10 o'clock in the morning and 5 to 8 in the afternoon. Mm-hmm. There's still a lot of people, and some comply with the restrictions, such as using facial masks and social distancing. But for example, in school, I noticed that some are not, they don't really implement restrictions, for example, in the children, right? So yeah, that's why the cases here in Spain are not still.
It's increasing.
Yes, it's still increasing.
My goodness. Okay, so I'm very interested for more updates coming out of Spain. Thank you very much, and you do take care, and take care of yourself, take care of others. Thank you, Beverly, for your updates there.
Thank you so much, Alma. Reporting from Barcelona, Spain, I'm Beverly Madrid. We live in interesting times.